If the Supreme Court, State Supreme Court, had ruled in favor of that patient, that would be truly remarkable.
Tonight, the state Supreme Court showing support for a hospital that didn't want an outside doctor ordering a controversial treatment. And that is our big story tonight at 10. The Wisconsin Supreme Court ruling today that a hospital cannot be forced to give treatment it doesn't believe to be medically sound.
Specifically, in this case, giving ivermectin to a patient with COVID-19. Madeline O'Neill is in the studio with what this ruling means going forward.
Ted and Mary, in a 6-1 ruling, the often divided state Supreme Court justices were nearly all on the same page with their ruling today.
When it comes to big decisions made in a hospital room, Dr. Jeff Potoff says doctors generally try to work with patients.
Where we get in kind of a tricky situation is if there's no evidence, or on the contrary, evidence that something harms you, it's really hard for physicians to say, let's go ahead and do that anyways.
In 2021, Aurora healthcare providers in Summit refused to treat patient Josh Zingsheim with ivermectin, noting the deworming drug is not FDA approved for COVID-19 treatment and it's risky. That's when Zingsheim's nephew, Alan Gall, went to court. Gall, authorized to make medical decisions for his uncle kept alive by a ventilator, sued Aurora. A Waukesha County Circuit Court judge ordered Zingsheim was to receive ivermectin.
If you look at the state Supreme Court's opinion, it's full of phrases like, we have no idea what legal theory this judge had in mind.
An appeals court overturned the circuit court's decision, ruling the lower court had no legal authority to compel a private healthcare provider to offer care below its standards. And the Wisconsin Supreme Court strongly upheld that decision Tuesday. UW-Madison American politics professor Howard Schwaber says an opposite ruling would have changed the state's medical landscape.
It's extremely difficult to come up with a legal or constitutional theory that would suggest that a patient can say to a hospital, you must give me treatment X, even if you think it's inappropriate.
Schwaber says the court's decision keeps medical decisions in the hands of doctors.
I think this was the state Supreme Court stepping back from the brink of what could have been an enormous kind of slippery slope leading no one knows where.
Gall's attorney responded with a statement saying Zingsheim lives today despite Aurora and ivermectin from an outside source saved his life. Now, we did have questions about that. We asked how the attorney how and when Zingsheim would have gotten ivermectin. She says she doesn't know, but she added that he is now recovering at home. And Aurora says they're pleased with the court's decision today. Ted and Mary.
Maddie O'Neill, thank you.